Good day everyone, I am Jerica Labrada, a level 1 nursing student from the University of the Visayas. And in this video, I'm going to perform our return demonstration regarding vital signs taking, which is taking a pulse. Pulse is a measurement of the heart rate or the number of times the heart beats per minute. So the purpose and significance of taking a pulse is to determine adequacy of peripheral circulation or presence of pulse deficit. So there are 9 pulse sites. This includes temporal, carotid, apical, brachial, radial, femoral, popliteal, posterior tibial, and lastly, the dorsalis pedis. So the equipment needed are stethoscope, cotton balls with alcohol, and watch with a second hand. So now let's begin with radial pulse taking. So the first step is introduce self and verify client's identity. Good morning sir, ako dahil si Jerica, imong student nurse karon. Ano sa ganito mong name sir?
Luis Mama.
Okay sir. Next is explain what you are going to do and why it is necessary. Explaining the procedure and providing information to the client fosters trust and cooperation. Sir, magkuha ko karon sa imong vital sign ha para ma-monitor na to imong pulse rate. Okay ra ba nimo sir?
Okay na ma'am.
Okay sir, thank you. Next is perform hand hygiene. Next is provide client privacy. This is to make client feel comfortable and promotes security. And then flex the client's elbow and place lower part of arm across chest. This is to expose the radial pulse for a more convenient palpation. Next is support client's wrist by grasping outer aspect with thumb to assist client in a more comfortable arm position when the radial pulse is assessed. Next is place your index finger and middle finger on the inner aspect of client's wrist over the radial artery and apply light and firm pressure until pulse is palpated because the fingertips are sensitive and can feel the pulse better when we do not use our thumb because it has a strong pulse of its own that could be mistaken for the client's pulse. Meanwhile, light but firm pressure is applied because too much pressure obliterates the pulse, whereas the pulse is imperceptible with too little pressure. Next is identify pulse rhythm and pulse volume because the pulse rhythm and volume will influence our manner of counting the pulse rate appropriately and accurately. Now, count the pulse rate by using second hand on watch in 1 full minute. Counting a full minute permits a more accurate reading and allows assessment of pulse rhythm and pulse volume. Next is document pulse rate in the client record. Because documentation provides ongoing data collection and comparison. By documenting the results immediately, the nurse takes note and prevents her from forgetting an important data because written records of the client become foundation of an efficient nursing action. So let's proceed to apical pulse rate taking. Cleanse the earpiece and diaphragm of stethoscope with an alcohol swab. This is to prevent cross-contamination and to ensure clear and precise auscultation. Next is raise the client's gown to expose sternum and left side of heart. This is to provide convenient exposure of the apical pulse for palpation without any restriction to attain accurate reading. Next is locate apex of heart. Place stethoscope at the 5th intercostal space in order to hear PMI. This is to make heartbeat clear and audible to attain accurate apical pulse rate reading. Next is inform client that you're going to listen his heart, instruct to remain silent. This fosters client cooperation and ensure that the place is free from any noise or distraction during auscultation. Sir, maminaw ko sa imong heartbeat ha, dili lang sa tamostorya, kadiyot raman ni.
Sige, ma'am.
Thank you, sir. With the dominant hand, put earpiece of the stethoscope in your ears and grasp the diaphragm of the stethoscope in palm of your hand for 5 to 10 seconds. This is to warm the diaphragm of the stethoscope. The metal of the stethoscope is usually cold and can startle the client when placed immediately on the chest. Next is place the diaphragm of the stethoscope over the PMI and auscultate for sounds S1 and S2 to hear lub-dub sound. Because heartbeat is normally loud as over the apex of heart, we listen for the lub-dub sound because it is what we count to assess client's heartbeat. Upon listening, we note the regularity of rhythm. The regularity of rhythm reveals pattern of time intervals between each heartbeat that tells the nurse count accurately and assess for possible abnormalities. Next is start to count while looking at the second hand of watch. Count lub-dub sound as 1 beat. A full minute count provides a more accurate assessment, especially if the heartbeat has an irregular rhythm, and each lub-dub is counted as 1 heartbeat because the 2 heart sounds are produced by closure of the heart valves. Next is share your finding with the client because it is the client's right to be informed with the findings. This fosters trust and cooperation in the implementation of nursing intervention. 67 beats per minute imuhang pulse rate, sir.
Okay, ma'am.
Next is record your findings. Because documentation provides ongoing data collection and comparison. By documenting the results immediately, the nurse takes note and prevents her from forgetting important data because accurate and detailed written records of the client become the foundation of an efficient nursing action.